School and Community Center monthly community meeting. I would like to start us off with a prayer. So if you don't mind, could we please bow? This is our monthly community meeting, and we're going to go ahead and start off in prayer. Good evening, God. We come to you thanking you for another beautiful day. We thank you for the beautiful rain, and we just thank you for allowing us to be here. Bless everyone who had to deal with the winter storm last week, and we just ask that you be with the families that had to suffer through that storm. We thank you for being able to be here this evening, and we just ask that you guide our footsteps and just continue to bless us as we inform and educate our community. In Jesus' name we pray, amen. So this evening I would like to introduce you to Elizabeth Watley with the Forest Theater. She's going to be talking to us this evening about the restoration efforts at the Forest Theater. And at this time, I would like to bring to you Elizabeth Watley.
Thank you, LaCheryl. I'm going to share my screen. Are you all able to see that?
Yes.
Thumbs up, LaCheryl. Perfect. So first, I just want to start with saying a big thank you to the St. Philip's team for having me and giving this opportunity to share this work with the community. I wish I could see all of your faces and people. I know the community meetings are filled with hugs and good food, but until we're able to resume, we will just continue here on the screen. So I want to give you an update on the project of the restoration of the historic Forest Theater. And this is an image of what we are working towards. When we originally acquired the space and met with community members, it was how do we make this an asset and how do we serve various different avenues to the community and the community needs and desires. So as we're going through today, you'll hear about three main components of the work that we're hoping to bring to the community. The retail space and the front here will be transformed into a community classroom that focuses on all genres of the arts. And you'll get to see a video of that and those features. And this addition is new. This is not currently existing. And this is an addition of a black box that transforms into a green box and a white box. So that way it supports both live and digital performances. This video gives you insight to what that retail strip transformation will look like. To your left, we want to be able to accommodate for both adults and youth. And so this is a resource hub where people can come in, access Wi-Fi, answer questions of where you can get specific resources within the community, and really have another gathering space for meetings and other opportunities to discuss different things. There's also private conference rooms that are not displayed in this particular video, but those exist as well. This facility will be a learning opportunity and also for adults have rental spaces where if you want to use any equipment or come in and have the opportunity to connect with other artists. To the left, it is a design studio where classes can be taught and held. There is a place in a facility that will host technology with your 3D printing machines and design, but really heavy in animation and editing bay, which partners well with the Black Box to really bring those creations to life in a really big scale. And one of the cool things is also the opportunity for a podcast room and recording studio, which was actually once already in existence in this space years ago when the Green Barrett was in the neighborhood. At the front, there is a space to have a podcast room, and you see people there looking in because there's the opportunity to have the audio facing outwards. So if you're recording a podcast room, or Erica Badu comes by and is dropping her album, people can join and listen externally as well as internally of the facility. This is a side view of the Black Box. This is to show another learning opportunity for students in the neighborhood. There is a light board on the side that is a marketing tool, but also a coding tool for lighting, and also different technology. And this is the back view. We wanted to bring some additional green space to the neighborhood, and we had the opportunity to do that behind. If you can see my arrow, you'll see the color of the tones of the brick change. This is the original theater. This is its current footprint. There is an addition of a backup house. That addition provides the ability to expand our performing offerings. The stage currently as it is, because the theater is in an original movie house, it does not have much room for a stage and opportunities for performance. So adding on that backstage significantly increases the usage of the space and the buildings. You'll also see here the extension of the black box gives opportunity for green rooms and other practice rooms for the facility. Another big piece of the community's feedback was to bring food options to the community in the neighborhood. And so you'll see that addition here that provides you with the ability to walk up, order food. You can sit upstairs or at the bar. I've been calling it a small burger bar, but that does not mean that they will only serve burgers. I just happen to be a fan of burgers. And this is one of my favorite spaces of the restoration. If you can see it behind me, it's my backdrop. This is the rooftop of the theater. This building is historically designated federally and state. And so working with the Historic Commission, they like to keep things as original as possible. And in 1949, the building did not have people walking on the roof. So we were really excited to get this passed to be able to bring this asset to the neighborhood where you can have a conversation or an event right behind the historic Marquis of DeForest Theater. Our efforts are to re-illuminate the tower of the Marquis for the first time in over 50 years. We will be restoring that with LED lighting instead of neon for several reasons. But one of the cool features of that is if the city, or if you have an event and the city turns pink, orange, or purple, we too will be able to accommodate that and turn pink, orange, and purple through the flexibility of using LED. And for the overall restoration of the space, we want to keep this as active and as flexible as possible to accommodate the community. So seating outside of the theater, as well as putting a cafe in the lobby during the day, which gives another opportunity for work, food spaces, and really utilizing the facility as much as possible for people to convene and accomplish tasks through gathering. Any questions? I can't see any of you, or if you're in a chat, but if there's time allotted, I'd be happy to answer any questions. All right, well, thank you for having me, and thank you for this time and this opportunity.
Elizabeth, that looks so nice. We are excited, and I can't wait to when everything is open. That was a really, really great presentation.
Thank you, thank you. Me too, I'm excited. Thank you for having me.
Sure. Okay, now we would like to, I would like to introduce Dr. Carolee Estelle. She is with UT Southwestern, and she will be talking about the COVID vaccine, and she will have a chance to answer any questions that anyone may have. I would also like to introduce Dr. Flowers, Dr. Terry Flowers with St. Philip's School and Community Center. He will be interviewing Dr. Carolee. And we also have Tyrone Jolly, who's going to facilitate questions from the chat. So with that being said, I would like to go ahead and bring up Dr. Carolee Estelle with UT Southwestern.
Good evening. Thank you very much for having me here to answer questions, and thank you for all the incredible work that you guys do in the community.
Dr. Estelle, thank you for your willingness to assist us with tonight. Our hope is that you will help with something that's very important at St. Philip's. We say that a day without learning is a day wasted. And it is our hope that you'll assist us with providing information so that those who are listening can be empowered, and not only for themselves, but also be in a position where they can spread the news and provide people with information about the vaccine and address hesitations that they may have and have them in a position where they leave today a bit more informed about the vaccine. So I have a few questions, if you don't mind, that we'd like to sort of dive into. It's been said that speed kills. And one of the things that is of concern in the community is that when the virus first came out, there was dialogue about it could take 5 to 10 years to find effective vaccines, and somehow, some way, in this case, it hasn't taken quite as long. What can you share with us about the vaccine, and the speed in which it has been developed?
Absolutely. So I am a physician in infectious diseases, and I get to serve as the interim chief of infection prevention and healthcare epidemiology at Parkland. And so by virtue of that work, I am extremely lucky that I have access to a lot of information that most people don't have access to. And I just sort of want to start by saying all of that to say it's very confusing out there. Not everybody has access to the kind of high quality information that I have because of my work, but also there's tons of information out on the internet and things like that, and it just makes it really hard. That is a baseline. And one of the things that most people don't realize is that it actually it wasn't as quick as you might have thought to develop these vaccines. And the reason is that in around 2002, 2003 or so, we had the first SARS-CoV outbreak, and that was in China, and it heavily affected Canada and a number of other places. We weren't completely spared, but we were pretty well spared from that outbreak. And that SARS-CoV is the namesake of the SARS that we're dealing with now, SARS-CoV-2, and they're cousin viruses. So back in the early 2000s, researchers got to studying and working on these virus. And then about 10 years later, in 2013 or so, MERS-CoV, another cousin to the SARS virus, it happened in outbreak form as well. And so scientists have actually been working on these viruses for about 20 years. And so they had gained a lot of information, a lot of knowledge. People were already actually working on vaccines and things like that because of the pandemic potential of these types of viruses. In addition to that, the vaccines that are currently approved here in the United States, they use a special technique, and that special technique, it was actually been being studied and worked on for about the last 10 years before the pandemic hit. So what was really going on is we actually were very lucky that information and science was actually where it was when the pandemic hit. And then on top of that, all of the scientists, or most of the scientists around the world, all put all of their focus into this one effort about about COVID and the vaccine, and were able to sort of really just finish the last mile, so to speak, on that work, and to do that quickly. And I think that's sort of just the kind of development end of the vaccine. The other areas that we gained a lot of time that people also normally we don't see. So whenever we study, we want to study medicines before we put them out, and there's specific ways, steps to that. All of those steps were performed. And one of the biggest things is the big clinical trial where we enroll lots and lots of patient volunteers. normally it takes quite a while actually to get, with these two vaccines that we have approved so far, they had more than 30,000 people in each of their studies. And a lot of times it can take a really long time to get that many people to come be in the study in order to know and make sure that it's safe, because you want large numbers of people involved to make sure that it's safe. Well, because of the pandemic and because everybody's eyes were on this and people were knocking down doors to get into these clinical trials, to be part of it, to help advance this and the like. And so they actually filled these clinical trials really quickly, and kind of, I don't know about record speed, but breakneck speed. They managed to fill these clinical trials to be able to show that it is safe. So that went pretty quickly because people were eager to participate and help. After vaccines and medicines and other treatments, after they've gone through all of those clinical trials, they'll then submit to the Food and Drug Administration, of the FDA, for approval and the like. And normally, the FDA doesn't drop everything immediately to review the studies and the data that's being presented. They often have to wait in line for a while, so to speak. And it takes, can sometimes take up to a year before the FDA will review that information. And so in this case, again, as soon as it became available, they reviewed all of that scientific data and the clinical trials and information that way. And the other really big place that we saved a lot of time was in the manufacturing and sort of the development end. Normally, they don't start any of that until the approval from the FDA has come through. And they started working on that at the very beginning, sort of simultaneously, so that we didn't lose time in the manufacturing and development end.
Well, thank you for that. That's helpful. Now, you said people were knocking at the doors, pushing down the doors, trying to get in to take the vaccine. So can you talk to us a little bit about the hesitation that many people would have because of America's history of betraying, particularly people of color, in terms of development of their medicines and ignoring the ethno-genetic makeup of African Americans in particular and Latinas? What would be the representation of those people knocking at the doors? How do we identify what the efficacy of this vaccine is with people of color, and knowing that we've had a lot of history with the Tuskegee study, the Henrietta Lacks, and so on? What information or insight can you give us in that regard? And I also know that Kasmikia Corbett is one of the lead persons, an African-American sister who helped with the development of Moderna. But what can you tell us for those who have concerns in that regard?
Yeah, the first thing is trust is a given, trust is earned, and people's concerns are valid and real. And that history and those behaviors and those institutions have to earn that back. I'm a firm believer in that. So, and none of that happens overnight. I'm not going to be able to relieve that broken trust in one conversation and in one action. But I will say the steps are being, the sort of steps have been being taken over time to start to earn that trust back. Things like the institutional review boards that prevent, people from doing those types of Tuskegee experiments and the like are in place, and the things. So regarding these particular vaccines that for COVID that we've got now, they actually did a really good job of getting people of color, Black and brown participants and volunteers did show up and show out. They actually, in both of the studies, they had just under about 10%. It was around 9-ish% for each. The Pfizer and Moderna clinical trials were Black, and then around the 20%, maybe 22, 24% for Hispanics. And so And in many other, not all, medication trials and vaccine trials historically, but a lot of them, they get like 2 or 3% of us, right? And then what they're doing is they're just saying, well, it probably works. Well, in this case, they managed to get a pretty close representation of where we represent in the population included in these trials, which is really important, because what we want is to be part of these trials, so that we know that it works on us and that it's safe. And they did that. So they got Black and brown volunteers to be part of this. And in looking at those studies and that data, they found that it was safe. There was no issues being raised from a safety standpoint, and it was still just as effective when we look specifically at those populations in it. So I think that was really important, that they put a focus on including us in the clinical trials. But also I think it's important, just like you pointed out, Dr. Flowers, that folks that look like us were at the table and in the room, so to speak, at the ground level of all of this. Dr. Kazmikia Corbett, a Black woman, was one of the scientists in the room, in the lab, making and developing this special technique that we're using. There's other physician leaders of color that were part of and helping lead these clinical trials as well, to make sure and be part of, to make sure that these sort of atrocities don't happen again. So I think, so we know that it works in us because we were included, but I think the trust is being worked on by including us and not breaching that trust at this time, if that makes sense.
It does. Thank you for that. And so if people are interested in getting the vaccine, how does that happen? Is it just for U.S. citizens? And if you're a non-citizen, is that information going to be tracked and used in any way other than the vaccine? And why would it be that if communities of color were disproportionately affected by the virus, that those communities wouldn't receive more access to the virus in comparison to the number of folks who were infected as well as died from the virus?
Yes, so the vaccine is available and for absolutely everyone, regardless of where you come from. If you have only a passport or an ID from another country or from another state, if you're here, we need to vaccinate you. That it's, if you're in our community, if you're with us, you need to be vaccinated here. You can't go fly back to another place and get it and come back. We want you to get it here. So that's a really great question. It doesn't matter what your ID is. It's really only about making sure we get your name and address so we can contact you and things like that. It's not about preventing anybody from getting it. No one will be tracked either from that perspective. And you don't have to pay for it. They shouldn't be asking for your insurance. If they are, they're not using it to charge you or anything like that. That shouldn't be happening anywhere. But if somebody mistakenly asks for it, it's not because you need to pay for it in any way.
So
your other question again?
There's no public record of who takes the vaccine, and is there a possibility of being deported from your information being utilized to identify who's taking the vaccine? Is that any point of vulnerability for those who may not be citizens of the United States?
No, not at all. So just like it's completely separate. It is not connected to any sort of border related agencies or anything like that. So no, we want folks to be safe and healthy, and so you'll get that. You'll get it. They need your name mostly for making sure we can get you the second dose, because it's several weeks later and all of these different things, and so that we can make sure that we know how much of the population has gotten it in general. But no, it will not be used in any any way to find or deport or come against anyone. Also, if you choose not to get it, there's not a list of people who don't want it and aren't getting it to come against them in any way or anything like that.
Great. And so for those who opt to take the vaccine or who are concerned about it, what about the reaction of the vaccine? So I have a quote that says, Google is not gospel. So you can't believe everything that's out there. Also believe the government is not gospel as well. So it's very difficult for the community to determine whether or not there are microchips that are injected into the body by way of the needle. There are all sorts of stories out there. And then the reaction to the virus, the reports of how it affects one, those reports vary in range of severity as well. Can you tell us a little bit about what to expect for those individuals that take the vaccine?
Yeah, so there's no chip in, there's no chip being inserted. There's no tracer elements or sort of cellular tagging of any kind that's being injected through the vaccine. So I just want to make sure that's clear as well. And then side effects. So so what is a vaccine doing in general? Vaccines are training our bodies, specifically our immune systems in our bodies, how to attack a particular infection if that infection tries to come into our body. And we want our bodies to attack it so that it doesn't make us sick. Well, the other thing is that our immune system is the one that attacks the viruses or the infections that come into our body. But our immune system attacking is what makes those symptoms like fever and headache and feeling really terrible and your muscles hurting all over your body, things like that. Those are symptoms that actually are a result of your body's immune system fighting an infection. And what vaccines are doing, and what these vaccines are doing, is they are delivering a code to tell your body how to recognize the COVID virus. And when it does that, then your body starts, that immune system starts working, and it starts learning how to fight it, and it kind of revs up a little and makes those symptoms or side effects. So it's actually expected and normal and okay. And you should expect, actually, if you get the vaccine, to have potential symptoms like feeling, pain in the site where you get the vaccine in your arm, potentially feeling really tired, potentially fevers, potentially headache. People have a lot of these symptoms, sort of similar to if you get the flu vaccine. So those are normal. And it's also important to note, just because if you don't get those symptoms, it doesn't mean that your immune system is not working. Everybody's body is different. Everybody's body reacts a little bit differently. So some people a lot of people will get those symptoms, but some people won't, and it's still just as effective.
Would you speak a little bit about accessibility? As I mentioned earlier, disproportionately, the urban centers have contracted the virus, but it seems that accessibility in those very sites where we had overwhelming impacts has not been equal to the need.
Yes. COVID has exposed what was always there, the disparities or the outcomes that are worse in some populations compared to other populations. We call those disparities, health disparities. Those come about because of many different reasons, all put together, longstanding racism being one of, sort of the foundation of that, right? And the whole system built upon that. And so there are these disparities, these differences in good outcomes in all sorts of health realms: heart disease, diabetes, blood pressure, obesity, all of these things, right? And the same is also true in COVID. And COVID has really sort of laid it to bear to the public and exposed it very in a big light. And so those same things that make that occur are also working against us as we try to get these vaccines and treatments out. Those same breakdowns, those same barriers are at play. And so, yes, that's happening. Yes, our Black and Brown people are getting COVID at higher rates. They're getting hospitalized from COVID at higher rates, and they're dying from COVID at higher rates. And so we, for certain, need to get the vaccine more in these communities. But the things that make those barriers are still there. And so it's places like you guys here at St. Philip's and community organizations and community leaders that we are gonna be looking to, or we are looking to help us get it into these communities. Technology gaps and access to the internet gaps, the language barriers, all of these things are working against us in getting the vaccines into these communities, especially since the registration process is electronic, it's online. And so there are community organizations that are helping work to help fill those gaps with the hospitals and the like. And so yes, that's very real.
Thank you. So I know there are other people who have questions for you. I'm going to ask one more and then turn it over to Tyrone Jolly to fill those questions that we've received from the audience out there. So some of us recall taking shots when we're in elementary school, and so there's a regimen of shots that you have to take there. Do you have a sense of how frequently those who take the vaccine will have to take it in the future? Is this an annual regimen like the flu vaccine? What's the future look like? And then if you would touch a little bit on this variant that is out there and how that can or cannot possibly overtake the effectiveness of the current vaccines?
Yeah, great question. So first I'll say, I don't have a crystal ball, so I can't totally answer the question. But what we do know, what I can say is that it's the short answer is it's probable that we're probably potentially going to have sort of repeat. Maybe not necessarily yearly, potentially yearly, but maybe it could be further out than that, but similar to the flu, having to deal with this on some kind of seasonal basis. So what we know is that when you have infection, when you get the virus and you have the virus, your body learns how to recognize and attack. The same immune system, we're using the immune system for the vaccine the way that it does it naturally, right? When you get infection. And so we have so far, studies have shown that people can get immunity for about 8 months from just having the infection itself. And vaccines usually actually make stronger immunity that lasts longer. So it's probable that it will be longer than that. But we don't entirely know. That's still all being investigated and evaluated as we speak. Then you add into that the variants that come up. So there are lots and lots of different variants of the COVID virus. It's a normal part of the virus life cycle, so to speak, that they multiply so quickly that sometimes they make errors on accident that lead to different versions of the virus. And that's how we get variants. And so the way we stop variants is by stopping the spread in general so that it's not replicating in any more people. But as long as it is spreading, there will be more variants that come around. When we get a variant, what we ask is, the first question is, does it cause more harm? Is it more deadly than the other variants? Does it cause more hospitalizations? And right now, the variants that are at play, they are not more deadly. They're not landing more people in the hospital. There is more work looking into that, and there's a little bit of debate among the medical experts about, is there potentially one that's developing that might be the case for? But right now, the largest body of evidence we have right now is that they aren't more deadly. And then after that, they ask, the question is, do these new variants, do our treatments and our vaccines still work against them? And so that's the big question, and that's the big concern as we get more variants. Eventually, some of them will potentially learn how to be resistant to our treatments or our vaccines. Right now, the variants that you're hearing talked about on the news, two of them, or most of them, I guess, seem to still be effective for the vaccines that we have currently available. And there's one that has developed some ability to evade that response, the antibody response, but the vaccines appear to still be actually highly effective, even though it's less effective than the prior variants. So the good news is right now, the vaccines that we've got available are still highly effective against all the variants that we have in heavy circulation.
Thank you. So we have questions in the chat, and I'm going to turn it over to Tyrone to walk us through some of those.
Yes, thank you, Dr. Flowers, and thank you, Dr. Carroll, for taking this time to speak with the community. Our first question from the chat. The current distribution effort for the vaccines is focused on individuals 65 and older or with certain pre-existing conditions. Do you have an idea for how soon, when people 64 and under will start to be able to have access to the vaccine?
So it depends on how long it takes us to get through things. So how long it takes us to get everybody vaccinated. So what I tell everybody is, just register, get registered everywhere that you can get registered. Anybody who will let you on their website and let you register, regardless of, if you're 24 or 54 or 75, get registered. And if someone comes to help you get registered, take advantage of that while it's available to you. And then as fill out all that health information accurately. And as they get to you, you'll already be in the list, and hopefully maybe you'll even be on multiple lists, and whoever calls you first, go there. I know when I've been out at some of these registration sites myself, helping get folks registered on pen and paper. Sometimes folks think that them having medical conditions makes them less of a candidate, would actually make it harder for them to get the vaccine, or that if they disclose or tell that they have diabetes or they have obesity, that they won't be able to get the vaccine. And in this case, actually, that's the total opposite. And those who have medical problems like obesity, like diabetes, like lung disease and things like that, these are actually that will make them call you earlier than those who don't have them. So that's a misconception I've seen out there that I also wanted to address.
Great, thank you. Another question from the chat. There are several manufacturers of the vaccine. Moderna, Pfizer, Johnson & Johnson just got approved. To your knowledge, which vaccine has had the most severe side effects?
So they're all actually really similar. So particularly Pfizer and Moderna, they're using the same technique. They're using the same method of vaccine delivery, and their side effects are practically identical. And then even for the Janssen, it's very, very similar. So I would say that none of them have any really sort of outliers in terms of concerning side effects. None of the ones so far.
Great, thank you. Wow, man, several questions coming in through the chat. I love the energy. This one, the attendee says, my immune building regimen is holistic and always has been. Dr. Carroll, tell me why I should consider getting the COVID vaccine. None of my holistic friends are planning to get it.
Yeah, that's a really good question. And what we're here to do, we're here to answer questions and empower you with information and knowledge to make the right decision for you. But one of the really, the thing about COVID is most people who get COVID, about 80% of them, they're going to have mild disease. A bunch of you aren't even going to know you had it. And it's going to be a cold flu-like illness that you have, it sucks, and you move on. That's going to be the majority of people who get COVID, okay? The problem is that other 20% that get really sick and land in the hospital or potentially die. And we don't know who's going to be which person, you just don't know if you're going to be the person who gets the really severe disease or if you're going to be the person who doesn't even notice that you had it. And that's sort of the main reason that we want to prevent it, because so many people are getting it, that proportion of people dying is a very lot of people dying, and we don't want to lose these people. We don't want to lose people before their time. And so in addition to that, our communities, Black and Brown communities, are more likely to get hospitalized and die from it. And so additionally, we're getting more severe disease compared to our counterparts. And again, that's because of many other, a lot of factors that is not race related, but all of the other factors. And so you just don't want to get it. In addition to that, as the disease has been around longer, what we're finding is that people are having long-term effects from this disease. And it's not just the people who ended up in the hospital or on a breathing tube. People who had very mild symptoms are 6, 7, 8 months down the line still having problems related to COVID. They're still having issues, and this is something we didn't totally anticipate, but you just don't know if you're going to be that person. And so really it's about protecting yourself. You don't want to be the one that gets a bad outcome from it, but also about protecting your own friends and your own family that are more vulnerable. But ultimately, it's up to you.
All right, thank you, Doctor. Another question from the chat. This one's about potential booster shots. If there's a need for boosters, when will they be developed and when will they be available?
Great question. So, well, if we're talking about boosters related to variants, some of the vaccine manufacturers that are available now are already working on boosters to address the variants that are circulating. And they're working on those trials and things to get those through. So they're already working on things like that. And then if you're talking about a booster of, hey, are we going to have to take this every year or not? That is really ultimately still going to be determined. The most important thing is that we get everybody, or as many people as possible, vaccinated now for this first round. And then we can kind of see where things are at and go from there for the next round.
Thank you. A few more questions. Dr. Carroll, I recently received information from my pediatrician that there was a pediatric study in the works. They were asking for youth participants. Can you tell us more about this clinical trial with children?
Yes, so the vaccines, both Moderna and Pfizer, they are working on enrolling youth in clinical trials so that we can have specific safety data looking at them and effectiveness data looking at them. So those are underway as we speak.
That's great. Thank you. Thank you. Any other sort of isolated groups that the studies are starting to focus on? People who are childbearing age or things of that nature?
Yes. So pregnant women were excluded from the original clinical trials. And so now they are looking at women who are pregnant, partly through just by virtue of making the vaccine available to everyone. It is encouraged for women who are pregnant to discuss with their doctors if they should get the vaccine or not. And as of maybe a week ago, about 10,000 women who were pregnant had already gotten the vaccine and were being evaluated. So that is also being looked at.
Wow, that's great. Thank you. Let's see. One last question before we wrap up. After being vaccinated, do we still have to follow the various safety procedures that are in place? Wearing masks, physical distance, et cetera. It's been a long time since I've seen my Aunt Flora, and she hasn't been vaccinated. Can we go to see family? How will things change for us after we've been vaccinated?
That is a really, really good and important question. So right now, it's really important, even after you get the vaccine, to continue wearing a mask and distancing, especially from folks who haven't had the vaccine yet. And there's a couple reasons for that. One, we still need to get the majority of folks to get the vaccine before we have that sort of, community protection that we're looking for. And we're not there yet. We're not anywhere close to it yet. So we want to get closer to that before then. In addition to that, the vaccines that we have available, when they were studied, they didn't specifically look to see if people who had been vaccinated and were protected from getting the virus or from getting symptomatic virus, they didn't take a look to see if they get asymptomatic virus and could spread it to other people. So what's still being investigated now with other continuing studies is, can vaccinated people spread infection? And so since we don't know the answer to that question yet, and not enough people in the population have been vaccinated yet, it's still important to wear a mask. Now, because we're all people, and I'm a person too, if you're with two people who are vaccinated and neither of you have any symptoms, I think it's okay to relax to some degree. I know I still mostly mask, even with all my colleagues and friends who have been vaccinated. As a healthcare worker, I have been vaccinated, and so have many of my colleagues and friends there. We still wear masks mostly, basically all the time, but then periodically, somebody's, having a drink or something like that. And we just are more relaxed when everybody in the room is vaccinated. But if you're around anybody who's not, we still want you to be very, very careful.
Great. Thank you very much, Dr. Carroll, for your time and just speaking plainly to the community and helping us understand, vaccination and our options. So thank you. Thank you to the St. Philip's School and Community Center for hosting the event. I will turn it back over to LaCheryl.
Okay. Yes, and just before we wrap up, we did have one more question. And I don't want to, I guess it's okay. I didn't want this person to feel like we didn't answer her question. She wanted to know, when will the funeral directors be vaccinated? Are they in, which group are they in?
In terms of, so the vaccine grouping isn't, so yes, it is based on sort of being a frontline worker. That is part of that. But right now, a lot of it's based on your own individual medical conditions and age and things like that. So it'll be a combination of those, but specifically for the professional field of funeral directors, I'm not entirely sure where that falls in terms of being frontline.
Okay, thank you. That's excellent.
And thank you for letting me be here. And thank you for all of you guys.
Oh, no, thank you so much. I hope we can continue to have these kind of conversations with our community. This was so good. I do know I got a couple of texts from some people in the community that had some power outages and were not able to join. And so I did let them know that this is a broadcast on YouTube where you can go back and watch it. So I know we will be sharing it out to the community. But I just want to thank you so much. This was so great. I want to thank Elizabeth Watley with the Forest Theater. We look forward to being in that facility and seeing what that's all about. But Dr. Carolee, thank you so much. This was very informative. I learned a lot myself this evening, and I know others did. And I just want to make sure no one else on the call has any questions. Okay, sounds like we do not have any questions. I want to go ahead and mention that on this Saturday, we have a diaper drive. We're going to be giving away free diapers as well as other things like clothing and shoes and formula. It will be this Saturday at St. Philip's School and Community Center in our front parking lot. And so it'll be from 9 a.m. to 12. We'll have donuts. And so just please come out. And if you know anyone with children, please send them our way. I'm sorry, I said 9 a.m. to 12. It's 9 a.m. to 11. But send anyone with children out to St. Philip's School and Community Center, and we would love to share this opportunity with them. I'm going to go ahead and close this in prayer. And again, just thank everyone for participating tonight. God, we just ask that you bless our families, bless everyone in the community, just continue to be with us and guide us. And again, just bless all the families affected by pipes burst and power outages this past week. In Jesus' name, thank you. Amen. That concludes our meeting for this evening. Thanks again for joining.
Kim, can you come here? I think I'm gonna try to, I think I can set it up without your Apple ID, at least so you can get text. Can you see, you know?
I
how
don't
to-
even want to, I'll just take it in, because
No, no,
even if all I can get is
Kim,
text.
Hi, we still have audio, but we're going to be wrapping up, and
They
thanks
can
everybody
send.
for joining.
I want you to know how deep to press your, I've gotten past where I need to be without you. Do you like the way it feels? You have 3 choices.